Fungal infections are another type of infection that we'll see of the skin in athletes very commonly. The technical term for this is dermatophytosis. These organisms have a very high affinity for keratinized tissue like skin and hair and nails. Tinea pedis is the most common form of fungal infections, which is on your feet. These infections cause the skin to be itchy and scaly, especially when it's focused at the interdigital space. And sometimes it'll become so moist and broken down that there'll be maceration or breakdown of the skin in this region. A variant of this is tinea capitis, where there's a scaly erythematous rash on your scalp, and sometimes this can create hair loss. Tinea curis is the technical term for infections around your groin or jock itch. The diagnosis of this is by clinical appearance and by scrapings. The treatment can range all the way for topical creams all the way to oral medications depending on the location, the severity, and the length of time that the infection has been present. A special comment can be made about tinea versicolor. This is a very common superficial infection caused by a ubiquitous yeast. It's on most of us. It tends to be very prevalently problematic in hot, humid climates. And what happens is it causes an area of hypo or decreased pigmentation of the skin. It'll create these discrete little fine scaly edge right where the skin is not so well pigmented. And what happens is that tends to be prominent on the back of the chest and on the back, as well as the arms and neck. Sometimes it's itchy. Something that is a simple treatment is using shampoos that would be used for dandruff, such as selenium sulfide or ketoconazole shampoos.